Here's how I describe type 2 diabetes to my patients. For a little background, I'm Liz. I'm a family nurse practitioner and I work in primary care. So I have the honor of describing this to patients all the time. I am going to use the lazy river method today. I created this as a little whimsy spin-off of, I used to use pipes to describe the inners of our body system. And one day I was describing it to someone younger and I used the lazy river and they loved it way more than the pipes description. So I've actually moved to the lazy river method for all of my patients and they've shockingly adored it because who doesn't love a lazy river? Am I right? All right. I'm going to hopefully show you up here what I sit down and draw with my patients in real time as I'm explaining this to them. I like doing this in real time with them because I can sit down, I can draw or put notes of what we're talking about and the questions that they have as they come up, but you do you. So without further ado, here is the lazy river method of explaining type 2 diabetes. So we have you, okay? You're beautiful. Look at you up there. And you have this marvelous organ called a pancreas. Now the pancreas does lots of things. And one of the things that it does is it creates insulin. Insulin goes into the bloodstream, grabs sugar and yanks it out because sugar, she's a chunkier molecule, okay? She is spiky and she cannot exit the bloodstream very well on her own, okay? And we're gonna give this little symbol to insulin and that'll make more sense in just a minute. So sugar over here, right? We get sugar through all sorts of things and our body needs sugar, right? It needs it for our brains, it needs it for our muscles in order to give it energy. We get this, some of it's made by our body and some of it we get by ingesting carbs. This is going to be things like bread, rice, pasta, sugar. And again, we need some, but we can start to have a problem when we have too much. And here is why. So let's think of our bodies on the inside as a lazy river. And in this lazy river, there's going to be people in little inner tubes. Okay, so we're going to draw, these are our sugar molecules. Okay, we're going to draw people in these sugar molecules. And remember, we talked about sugar molecules earlier being like large and kind of pokey. Think about those little, you know, those balls that fall off of the trees and they have all those little like spikes coming off of them. That's kind of sugar. So we have these people that are sitting in these rafts, right? And their feet are sticking out, okay? They are just hanging out. They cannot get out of the lazy river on their own, okay? Because have you ever tried to get out of an inner tube on a lazy river? It is very difficult and it is not graceful. Therefore, we need insulin, okay? With its little hut. These are lifeguards, okay? Insulin is the lifeguards in this situation. And the lifeguards are stationed around the swimming pool so that they can yoink out the sugar inner tubes, okay, as it floats around because the body needs some. And then they go distribute it to the muscles and the brain and whatever other stands that are around that need the sugar in order to operate. Now we've been checking your blood sugar, right? And we've been seeing that it's been slowly going up. Your fasting one has been above 100, your hemoglobin A1C, which is your 3-month blood sugar kind of accumulation, that's been going up a little bit too. So that tells us that you are slowly accumulating more sugar in our river, okay? And it's starting to get a little bit crowded. And the insulin is trying to keep up. And we have maybe added to this water park a few more lifeguards, okay? Because the water park realized, oh man, we are not keeping up with demand. But at a certain point, the lifeguards are starting to actually not even respond to the extra inner tubes in there because they're a little bit overwhelmed. And for whatever reason that is, we're not yanking out enough sugar. The sugar to insulin ratio, so the lifeguard to inner tube ratio, it is no longer keeping things going as we would like. So all these people start to accidentally bump into the walls bing, 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 with their feet and they're kicking the walls all over the place because they're a spiky molecule, right? And they are causing damage to the walls of this lazy river. That's not good. That's happening in your veins, okay? Because this is all your venous structure, in case we didn't make that clear earlier. And over time, the problem just gets worse. The lifeguards get more and more overwhelmed. The insulin is becoming more and more resistant, if we've heard that term used before. It's saying, I can't keep up, so I'm just going to become less and less useful. I'm going to yank out less and less sugar molecules. And your body then has more and more of the inner tubes causing more and more people to kick the wall, causing more and more damage. Now, what happens when we have damage to the walls? Your body is going to try to repair the damage just like we would repair the damage in the pool. So we're going to come over and we're going to start to patch some of these holes. But what happens when you patch things? It crumbles more and it falls off. That doesn't sound very good. And that's going to really lead into more inflammation. And that's going to be a whole other conversation that we can have about high cholesterol, because that actually ties into that really well. But just know that it's damaging the walls of the lining of your veins and arteries, and that's not ideal, right? Another thing that can happen with all of the people kicking the walls is all of this water has to go through a pool filter. And this filter is the kidney. That's something that filters all of our blood as it's rushing through our body. It has these nice little small holes so that big particles of pool yuck can get trapped in it, but it is quite prone to damage. And let me tell you, the kidney does not love when people come through here and kick it. It's very sensitive about that. And as people come through and they kick the kidney filter, or these bigger sugar molecules come through and they're bonking against the side of the kidney, it causes damage to the kidney filter. It causes inflammation and swelling. And what happens when the kidney gets really inflamed like this? The filter, the holes in the filter of your kidney also get inflamed and they get bigger. And this is going to let other things pass through the filter, because the filter used to have teeny tiny holes. Nothing could really get through, but now all of a sudden the hole is bigger and you can get things like protein that decides that it can get through because it's a bigger molecule. Sugar can sometimes come through the actual holes. That's when you're getting glucose or sugar in your urine. All sorts of things can start to come through this filter, and those things are not supposed to leave the circulation. It's supposed to stay in the lazy river. That's why we're going to check your urine sometimes, just to make sure that nothing is getting past the filter that shouldn't get there. And all of this just makes your kidney unhappy. It's unable to filter as well. That affects how you take medicine. That affects just how you regulate the breakdown of regular muscle, all the stuff in your body. We want your kidneys to stay healthy, and this is damaging them. And another thing that can get damaged when we have people kicking the walls of our river is our teeny tiny rivers are going to get, when they get damaged, they're going to close off, right? Because the more debris and chaos that we cause, if it's a teeny tiny river, it gets clogged, right? It all falls in on itself. So things like your eyeball, the tiny, tiny little veins and arteries in your feet, our tiny, tiny vessels are going to get damaged, and they're just gonna, fine, I just will close this river. And that causes things like diabetic retinopathy, where you can no longer see. And when people have numbness and tingling in their feet, if you've ever met anyone with diabetes that has feet issues, it's because their blood supply to their feet kind of just closed off. And it was like, well, never mind. So to kind of recap, we have a bunch of sugar that's going around. It's damaging the lines of our arteries and veins, or our lazy river. And as our arteries and veins are literally what carry everything all over our body, that's not ideal. We have the pool filter, which is being damaged and letting things through, so our kidney's not happy. And we're potentially going to have damage to our eyeballs and our feet and all of our tiny little blood vessels. So what can we do to make sure that this doesn't happen or decrease the effects of what is going on? We can, consume less sugar, right? We can put less people into the lazy river. That's going to be not eliminating, but just portion sizing our carbs. So again, our bread, our rice, our pasta, our sugar intake. If we have less people in the pool kicking the walls, we're going to have less damage. The second thing that we can do is increase the people who are yelling at the lifeguards, okay, who are yanking people out. Because remember, the lifeguards are kind of getting a little bit resistant to doing their job, okay? They're feeling a little overwhelmed. But if we start exercising and moving our muscles a bunch more, that is going to increase the demand for insulin. And all of a sudden, all these little pool huts all over are going to be screaming like, hello, we really need more sugar. So that's going to increase the lifeguard's sensitivity to what they're doing. And they're all of a sudden going to yank a little bit more sugar out. And that's going to only have a positive effect. Exercising will keep your insulin sensitivity up for many hours after you actually exercise. So this is going to be an effect that you get all day long. It doesn't have to be crazy exercise. It can just be any kind of movement of your body that you enjoy. And the third thing that we can do is talk about medication. That can be a different video if anyone's interested. And then I ask them if they have any questions. And that is the gist of the lazy river method of explaining type 2 diabetes. Like I said, have had a positive response of people finding the slightly more whimsy, like approachable. But again, you do you. If you like pipes and all of that and plumbing, that works just fine. This pairs really well with a conversation I have around high blood pressure and hyperlipidemia. If you are interested, I can make videos on those because all of this stays within the lazy river realm and they all tie in together really nicely. And this conversation was obviously very simplified. If you are having a conversation with someone that has way more intimate knowledge of physiology and all of that, you can step it up to whatever level people are at. I have found this is good for the general public who we just need a brief overview. And also this is trying to fit into a appointment slot that is not very long. Okay. So this is usually just our introductory conversation. And in terms of when to have this conversation, I do think it's helpful if we can catch it before we are actually at the point of someone having type 2 diabetes. If we're in the pre-diabetes range, that's ideal. If we even see our blood sugar creeping up close to the pre-diabetes conversation, that's usually a great time to have this, just so that it makes the situation real. Because I think sometimes we can throw around the terms of like, oh, like you have pre-diabetes, and it's like, okay, whatever. And asking people do you know anybody with type 2 diabetes at the very beginning, I guess I should have put that in the very beginning, it's fine, is helpful because a lot of times they have real world examples in their head. Their dad had it, their sister has it, and they've started to see some of the side effects of it, and they'll be worried about that. And you can build that into the conversation as you're having it. Like, hey, you know how you said your dad can't feel his feet and he gets wounds on them all the time? This is why, because those vessels are so damaged by, the sugar kick in the walls. And you can build that in and make everything tie together for them. So that is my basic rundown of how I explain type 2 diabetes. I do have some resources for type 2 diabetes in my NP binder. If you have that, you can check it out. If you don't, it's just basically like my primary care notes and links to resources I use all the time. And I will link that down below. And let me know if you want to see some of those other videos of how I link this together with like high blood pressure, all of that. And I can certainly make those. I hope you have a wonderful day. And I hope you remember, as always, that you are not alone, you are enough, and you can do hard things. Have a great day. I'll see you next time. Bye.